Thank you, sir. Thank you, and thanks to Kimpro as well as CAHO for giving me this opportunity to present over here today. So, myself, Dr. Darshana, I'm a Chief Intensivist and an Additional Director at H.N. Reliance Foundation Hospital. Something that we did as a quality improvement project, which I was inspired by my leaders who told me to do something on a clinical level to show some improvement in our day-to-day practices in our ICU. So we created something which is known as the ventilator pathway, and it is a clinical pathway for a quality improvement. As you all know, the pathways are tools which are to be adopted or developed. These are based on evidence-based care, and adherence to the pathways leads to standardized care and better outcomes. So what did we do, and how did we find out the problem? As you all know, that CDC has already defined that almost 3 lakh patients who are on ventilator have a poor outcome because either there is a difficulty in the monitoring, in the weaning, or there is a prolonged stay in the hospital. And initially, something which we all have practiced over the years has been about the VAP bundle and about only checking on ventilator-associated pneumonias. But in 2013, the CDC had themselves come up with something which is known as a ventilator-associated event. And ventilator-associated event has a lot of other components which are leading to the mortality of the patient, like collapse of the lungs, ARDS, pulmonary edema, and many other components. So these are things which are at the bedside which we need to take care of. And we did a retrospective analysis of 5 months of our patient who were on ventilator, and we noticed that the VAE rates were 33.8%, and the LOS was average stay of around 37 days and mortality rate of 14%. So what did we do? We also did an internal survey to check on the practices of what are already set practices and some of the components of the ventilator pathway which we thought to include. And we noticed that there was a discrepancy amongst the nurses, the doctors, the understanding, as well as there was not a complete implementation. In fact, some of the results were very poor. So we set up our targets, and we said that for all components of the ventilator-associated events, we will target for a reduction by 50% from the baseline and reduce the mortality rate by 50% as well as the average length of stay. So as a problem remedy, we created the ventilator pathway. There is already an AHRQ tool which has for reducing the ventilator-associated events, and that is what we adapted. So it has definitely head of bed elevation, which is also a component of the VAP bundle. It has subglottic suction drainage to be applied to the tracheostomy or the ET tubes, early mobilization, implementation of RAS score, and one of the most important component is to prevent delirium. So CAM ICU scoring is one of the things which we all know, but it is not actually checked and it is not actually implemented on what are the components which are to be used to reduce the delirium, and the SAT and the SBT trials which we follow over there. So we created the bundle, and not only the bundle, we created some of the bundle's compliances, how we will measure the compliances at the bedside. And for this, we created a training program, as well as this, the ventilator bundle was in a placard format which was stuck on each ventilator of the ICU. So even if somebody came new, they could see that and see what were the components of the ventilator bundle. And this was also a refresher training with the results, as well as for the new joinees at the time of the induction. And this included the entire team, which included the doctors, the nurses, the physiotherapists, the respiratory therapists, everyone included. So the pathway was implemented in all our 4 ICUs, and the tangible results that we saw was that for the first 5 months, in a retrospective analysis, we had a VAE rate of around 33.8%. In 5 months, we reduced it to 10.7%. And what LOS we had of 37 days, we reduced to 27 days, and mortality from 14% to 4.2%. Now, any pathway or anything that you do, it's more important on how you're able to sustain it. And that is what we did in the last 1 year, where we not only sustained the pathway, but we also further reduced the rates. So the VAE rate reduced to 6.2%, the LOS reduced to 19 days, and mortality to 3.8. And this is the components that we check, and that is how we give our results. So it's all about sustainability and a multidisciplinary care in a standardized way. Thank you.